Hi, I'm Erin with After Cancer, a resource designed for cancer patients and survivors to help them find intimacy again. Thank you for joining me today. This is the first in a bi-weekly video series on topics related to sexual dysfunction after cancer. There are more than 14 million cancer survivors in the country today, and that number increases every year. More and more patients are surviving their disease, but millions of those people are suffering from sexual dysfunction caused from their treatment. According to the National Cancer Institute, estimates of sexual dysfunction from various cancer treatments range from 40 to 100%. And who's talking about this? Sex is such a curious topic in our society. Though we are inundated with sexual images everywhere, from what we watch to what we read to what we wear, sex is everywhere. Yet it's difficult to have meaningful conversation about it. We can joke about it, we just can't talk about it. But we're going to talk about it here. In 2008, I was diagnosed with anal cancer. It was the most fearful, confusing time of my life. I was told that my treatment would be chemotherapy and radiation over a 5-week period of time. I was told the side effects would include sexual dysfunction. Well, actually, the side effects were listed as sexual dysfunction, but I was told it wouldn't be an issue. Because I was young, healthy, sexually active, and wasn't having internal radiation rods. Throughout my treatment, of course, sex was not on the top of my list, so I didn't know whether sex would be difficult for me or not while I was in active treatment. When I was healing after treatment, I was told to wait 6 weeks before my husband and I could resume our regular sexual activity. I was told for sexual intercourse, 2 tips: we should go slow and use lubricant. So in preparation for that, we talked about whether or not I thought this would be difficult. I couldn't tell. I couldn't tell if my body had changed. When we attempted intercourse for the first time, it was met with tears and blood, and we both felt very defeated. Actually, every attempt, we failed. It was so terribly painful, not something that I could have even worked through. It was surprising to both of us, not understanding how nobody could have known that this was going to happen. In one of my first follow-up visits, I brought it up to my physician. He was surprised about it as well and referred me to a gynecologist. I was quickly put on an estrogen cream, a suppository moisturizer, an estrogen suppository moisturizer, dilation tools, and rehabilitation therapy. I did all of that for years. It remains a constant challenge for me, from both the chemo side effects and the radiation side effects. There's so much I learned about not being able to have intercourse with your husband. It was not only physical. It didn't impact me just physically. It impacted me emotionally, and it impacted our relationship. It was difficult for us to have the same sexual script that we'd had before cancer. Before cancer, we were spontaneous, we were sexually active, we were interested in having sex, and it was a way that we not only expressed our love, but it was a way we communicated. After cancer, none of those things happened. It was painful, and I didn't look forward to it. What I learned from other cancer patients when I began to advocate for them was that there are many side effects very common to cancer treatment. Erectile dysfunction in men, of course, painful intercourse for women, but also the loss of libido, the interest in having sex, and fatigue. And body image issues are really quite common. Along with communicating with a partner is difficult. We may sleep with them, but it's difficult to talk to them. Sex, again, is a topic that is just not easy for all of us to discuss, which is why possibly it isn't discussed in the medical setting either. There's a real communication gap between us and our medical providers. On the medical provider side of things, the economics of medicine does not make this any easier. There isn't a lot of extra time in the day to give to this topic. Our appointments last 6 minutes maybe with the doctor? sexual intercourse or the problems with sexual activity isn't on the top of our list during those appointments during active treatment. It's only after treatment that we may realize that we have an issue when we aren't seeing our doctors every week. But also on the medical provider's side, they haven't had formal training on how to talk about this topic. And there's a right to privacy concern. If we have other people with us on our visits, whether it be our children or our spouse, a physician wouldn't know if it was appropriate for him to talk about it with those people in the room. There are many barriers to making them comfortable having this topic discussed in a medical setting. And for the patients, it isn't easy for us either. We're embarrassed as they are. We wonder about a negative reaction from them if it's brought up. It's not always a real safe and supportive environment to talk about this topic. It's not always quiet. There isn't always just one person in the room uninterrupted. And we also worry about a negative reaction. What if we said we have a problem and they asked us to explain it more? Sex isn't easy to bring up, let alone to go deep into. This is something that we need to bridge. This communication gap isn't healthy for the millions of cancer survivors that are suffering in silence. What questions do you have about your sexual health after cancer? You'll find great resources and information at my website, aftercancer.co. And while you're there, sign up for the community of survivors with the same issues that we've discussed today. I provide advice, resources, and tips on sexual health and sexual dysfunction on topics as we've discussed today right to your email inbox. Comment below or contact me at the website aftercancer.co. Thank you.